A 13 years old boy fell on his bicycle handlebar before 2 weeks, now presented with abdominal pain and distension.
كورونا الأقوى دكتور بالزحمة.
تمام.
ولا الزحمة دكتور، سوي لي إياها النيتيف والكونتراست بالأكزيوم.
غفران ايش تشوفين؟
The multi-section CT scan showing linear hypoattenuating area in the pancreas associated with a thin wall where circumscribed cystic lesion. Also there is a left-sided mild amount pleural effusion and fluid pre-splenic fluid collection. الهيستوري مال البيشنت إنه هو عنده يعني trauma blunt trauma most likely go with pancreatic injury يعني pancreatic trauma. يعني according to the picture cystic lesion اللي أعتقد هي إنه pseudocyst due to collection of fluid from the trauma يعني هو transverse hypoattenuating line، فهو مو superficial injury، يعني أعتقد هو يعني لا grade 1 ولا grade 2، يعني advanced injury بالبنكرياس بالdistal part of the pancreas.
نعم. يهمك السي هذا ايش قد الهيستوري مال التروما مالته؟
طبعا أستاذ، لأنه السيدوسيس من متكونة معناتها هذا مو ريسنت، مو أكيوت إنجري يعني، وكمية الفلويد كولكشن يعني إنه هذا معناته هذا أولد إنجري. السيدوسيس ما تطلع
قد الهيستوري مالته علي مال التروما؟
المفروض 4 ويك يعني
before
ولا
2 weeks.
تتكون.
نعم؟
أي
before 2 weeks.
أي أستاذ، يعني مستحيل تطلع السيدوسيس إنه يعني بريسنت إنجري.
نعم. يعني انت هذا برايك هذا بنكرياتيك سيدوسيست؟
يعني أستاذ هو يعني single well defined، وأكو عندنا هيستوري مال تروما، فيعني goes with the acidosis.
انت شفتي هذا السيستيك ليجن اللي هو من السبفرينيك نازل للباراكوليك بالليفت
هذا هو
سايد؟
أنا أعتقد أستاذ، هذا أعتقد لا، هذا مو هذا اللي أقصد عليه أنا، اللي جوا شوية مبين بالبنكرياس أكو well defined cyst، هو هذا السيدوسيس. بس هذا هذا أعتقد يعني loculated hemorrhage due to يعني due to injury، وحتى هو associated with the left side pleural effusion، فيعني هذا كله complication مال يعني مال الانجري.
نعم.
هذا قصدي عليه أستاذ.
شكرا غفران، شكرا جزيلا.
عفوا. عفوا.
صابرين موجودة؟
نعم
صابرين جبار.
نعم أستاذ،
صباح
صباح
الخير
الخير.
صابرين، صباح الخير. علو شنو رأيك صابرين؟
والله أستاذ، مثل ما قال زميلتي دكتورة غفران، يعني كل اللي نشوفه بالكونتراست انهانسد اكزيال سي تي هذا انه هو هذا سيكويل مال انجري، انه مدى نشوف التيل اوف ذا بنكرياس بصورة واضحة، بينما الهيد ويعني جزء من البودي انه انهانسينج ولوكس نورمال، ومالتيبل سيستيك ليجن تمشي وياه انه يكون سيدو سيست كسيكويل اوف تروما. بس مثلا مدى نشوف انه يعني الليفر والسبلين والكدني انه نورمال، مدى نشوف بيهن اني لاسريشن او اني مثلا يعني ساين اوف يعني افكشن. بس ميلي التروما صايره على البنكرياس، وميلي صايره جريد 3، يعني صايره ترانسكشن بالتيل اوف ذا بنكرياس with the pseudocyst formation كسيكويل.
What is next صابرين هذا المريض؟
والله عمي احنا ذا نيكست المفروض سيرجيكال اكسبلوريشن، يعني المفروض احنا نسوي له سيرجيكال اكسبلوريشن، لان اللي واضح عندنا انه هو ادفانس انجري ترانسكشن بالتيل اوف ذا بنكرياس، وحتى الدكت 100% يعني افكتد، فبالتالي نسوي له يعني سيرجيكال اكسبلوريشن، يعني نسوي له ديستال بنكرياتكتومي يعني وحتى يشيلون السيدوسيس.
نعم. شكرا صابرين.
شكرا استاذ.
احكي لنا على شنو الكيس واذا مسوي توك تفضل.
نعم أستاذ مثل ما تفضلتوا أنه grade 3 high pancreatic injury associated with the pseudocyst formation as a complication. طبعا هاي X-ray of the same patient. هو قبل اللي يدزوا CT دزوا X-ray. نشوف elevation of left hemidiaphragm وأكو displacement of gastric and intestinal shadows. يعني indicative of there's something. Pancreatic trauma. The pancreas is uncommonly injured in blunt trauma. However, pancreatic trauma has a high morbidity and mortality rate. The pancreas is injured in 7.5% of blunt trauma cases. Motor vehicle accidents account for the vast majority of cases. Penetrating trauma constitutes up to a third of cases in some studies. Clinical presentation, the classical triad of fever and raised white blood cells and amylase is rare. The serum amylase and the lipase are elevated in 80% of cases, but distinguishing between a raised amylase or lipase as an acute phase reactant or resulting from a pancreatic injury is difficult. Non-specific clinical signs are C12 sign or flank hematoma. The pancreas body account for 2/3 of injuries and 10% occurring in the head, neck, and tail, يعني together. Due to its retroperitoneal location and oblique course, It's prone to compression for compression against the vertebral column. Due to the course of the mean pancreatic duct, it may be injured in the trauma to any part of the pancreas. Grading, who according to the American Association for Surgery and Trauma هو يقسمها إلى 5 grades. يعتمد على البروكسيمال pancreas والديستال pancreas. البروكسيمال pancreas هو definition مالته is the part of the gland to the right of the superior mesenteric vein or portal vein axis. بينما distal pancreas is to the left of the axis. And the term deep refers that the injury is to the level of the duct, whereas the superficial is injury superficial to the duct. فحسب هذا المفهوم أنه الجريدات تنقسم إلى grade 1. There's only a minor contusion or superficial laceration. Grade 2 تجي major contusion أو laceration without duct injury. Grade 3, there's distal transection or deep parenchymal injury with duct injury. Grade 4, تجي proximal transection أو deep parenchymal injury involving the ampulla. وأكيد وياها duct. Grade 5 اللي هو massive disruption of the pancreatic head. Examples of the grades. Grade 1, there is only here a superficial laceration of the pancreatic body. There is a minor contusion involving the pancreatic head, which is also a grade 1. And then grade 1, low superficial laceration, low minor contusion. Grade 2, there is a major contusion without duct injury, or there is a major laceration without duct injury. يعني grade 2 ما يصير بها duct injury. Only deep laceration or major contusion. Grade 3, parenchymal injury associated with duct injury, or there is distal transection. مثل هاي الكيس اللي شفناها. Grade 4, there is a proximal transection or parenchymal injury involving the ampulla. Here, coronal CT, there is a proximal transection of the pancreas. This is another example. Grade 5, there is a massive disruption of the pancreatic head. Here, an axial CT showing that there is a massive disruption of pancreatic head and replacement, and there is no contrast enhancement. Only part of the pancreatic head and tail exist in this image. Another more simple method of classification of pancreatic injury by Wong et al. Grade A in this classification is only superficial laceration. Grade B تنقسم إلى B1 to B1, there is deep laceration involving the pancreatic tail. And B2, there's complete transection of the pancreatic tail. Grade C, there is deep laceration involving the pancreatic head. And C2, complete transection involving the pancreatic head. Associations of the pancreatic injury. It is uncommonly less than 10% an isolated injury, and other organs that also may be injured, including the liver and the stomach, major vessels, spleen, kidneys, and duodenum. Here an axial CT showing pancreatic laceration, distal laceration, associated with the devascularization of the left kidney, which may indicate injury to the renal artery. Now go with the radiographic features. There's direct signs, hypodense lacerations or communication of pancreatic parenchyma, transection, heterogeneous parenchymal enhancement, enlargement of the pancreas, hematoma, fluid collections communicating with the pancreatic duct. Secondary signs, peripancreatic fat surrounding fluid or hematoma between the pancreas and splenic vein, thickening of the anterior pararenal fascia, peripancreatic retroperitoneal fluid, intraperitoneal fluid, especially in the lesser sac, and adjacent injuries to the spleen and liver and biliary tree and duodenum. The complications of pancreatic trauma occur in up 20% of patients and are more likely in higher grade injuries. Complications may include pancreatitis, occurs in 6 to 10%, fistula, more common with the pancreatic duct disruption, abscess or sepsis, hemorrhage. Hemorrhage may be from the pancreas or from a pseudoaneurysm, and finally pancreatic pseudocyst. This is a pancreatic injury, distal transection associated with pseudocyst formation. Here another pseudocyst extending along the lesser sac. Treatment and prognosis. Delayed diagnosis raise both the mortality and morbidity of traumatic pancreatic injuries, both of which are high, with a mortality rate up to 20%. Injuries with the pancreatic duct disruption are more likely to undergo endoscopic stenting, whereas surgical intervention such as wide drainage and distal pancreatectomy is preferred in grade 3 and grade 5, grade 3 to grade 5 injuries. Options of treatment for pseudocysts. Although pancreatic pseudocyst may regress on its own and requires no further treatment, interventions are required in selected cases, particularly those complicated with infections and larger size causing a mass effect symptoms such as gastric outlet obstruction or bowel obstruction, hydronephrosis, and biliary obstruction, or their diameter increasing in size or greater than 5 cm. Recurrence following previous resection or aspiration, and persistent symptoms. The treatment options include open surgical debridement or cyst enterostomy with Roux-en-Y jejunal loop. Endoscopic drainage into the stomach or duodenum is termed as cyst gastrostomy. Percutaneous drainage remains somewhat controversial, although increasingly accepted. Many centers report high safety and efficacy. Critics raise concern regarding potential reaccumulation and fistula formation to the skin, especially in patients with severe pancreatitis. Another treatment option is octreotide on infusion that decrease the amount of the pancreatic secretions. هنا نشوف اكو stent between the stomach and the pseudocyst for drainage of the pseudocyst. And here there's percutaneous drainage of the pseudocyst. There's a drainage of the cyst. And thank you.